Hello everyone, my name is Vanessa Gary and I am a pediatric nurse practitioner student. Today I want to talk to you about the evolution from a PBX operator to cell phone. The technology application that I chose is the hospital PBX operator/communication system. It routes urgent provider phone calls and it's the primary hospital communication pathway between nurses to physicians. It's intended to connect callers to the appropriate provider that they asked for, reduce communication errors, and support coordination of patient care. This is significant to the labor and delivery unit because you need rapid communication between your nurses and physicians to help save both mom and baby's lives. You need timely communication, especially when it comes to emergency C-sections, postpartum hemorrhages, fetal distress, or critical lab results. And lastly, any minute can significantly affect a patient's outcome. The problem with this application is that nurses contact operators before physicians, so a lot of times you are being put in a queue by the operating system, and when you call they tell you if you are first, second, third in line, and you wait until it's your turn, and then you can be transferred to the position that you were requesting. The operator queues delay the urgent communication because you cannot get a hold of your provider quickly and can impede patient care. Critical lab results can be delayed if you're trying to get them to the physician urgently, and multiple handoffs increase communication errors. This is important because if you call a operating system and they tell you you're second in line, but somebody else picks up and they tell you you actually have to wait a little bit longer, it can cause some communication errors between you two. Some examples that are specific to labor and delivery are recurrent fetal heart decelerations. This is very important because you want to tell the provider right away and you want to request them to bedside. Oftentimes, operator queue delays, physician notification, and then they don't get to the bedside when you need them, and that can delay the patient's care or give the baby a poor outcome. Postpartum hemorrhages. This is very important because the operator pages the OB provider, and if you are waiting in a queue, your interventions are delayed and the patient is continuing to bleed even though you have done everything you can do. Lastly, critical lab results being reported, such as severe preeclampsia. Somebody comes in and they get their lab work done and it shows low platelets. You want to tell the provider right away so they can identify what may be going on with the patient, but if you are in the queue for a while, it delays that provider notification. Some consequences to this application is delayed treatment, reduced workflow efficiency, staff frustration just because they feel like the communication is lacking, and insufficient training, unclear responsibilities can cause communication errors and problems, and then increase patient risk. For my evaluation, I broke it into 3 parts: individual fit, task fit, and technology fit. The first one I'm going to talk about is individual fit. So what do we need? We need immediate provider access during emergencies. But what challenges do we face? We face operator queues delaying our communication, uncertainty that's adding emergency stress, repeated calls that increase the workload, and then when you go to the FITT assessment, you see delays in the high acuity communication, the workflow needs direct provider access, and then you see a poor technology task fit. Moving forward, we're going to talk about task fit. So the intended task is that rapid notification of physicians to the interdisciplinary team, whether it be nurses, OT, PT, really anybody who's involved with the patient's care. However, our current workflow is that the nurse goes to the operator first and then to the physician, which is causing some issues. It's causing delay in escalating urgent patient concerns, it's causing increased time to the physician notification, and potential message miscommunication. There are some gaps that are also identified, and it's that the PBX system is not EHR integrated system, meaning that PBX can't see what we see on our computer and on our end, so it's really hard for them to understand the criticalness of our request. And then there's no automated critical alert escalation. When you look at the FITT assessment, technology is adding workflow complexity. Lastly, we're going to talk about technology fit. There are some goals identified, and they are reducing delays in care, supporting rapid response to emergencies, specifically with the physicians to bedside, enhancing communication efficiency, and improving patient safety. However, our current state has us relying on operator availability and limiting our ability to track message receipts. The FITT assessment identified efficiency and patient safety that are impacted. Impacts on patient safety, there's quite a bit, but specifically there is delayed physician response causing the delay for the provider to get to bedside for obstetric emergencies such as non-reassuring fetal heart tracing, postpartum hemorrhages, or severe hypertension. There's an increased risk for adverse maternal and neonatal outcomes, and it also causes a delay in the communication of critical lab results, so the patient's not getting any blood products that they may need, or electrolyte replacements in a timely manner because we are waiting for the physician to get notified. How does this impact workflow? Specifically for nursing, you have to take account the time spent on the phone waiting for the operator. You have to repeat calls to verify communication was performed, and this can cause an increased frustration because you are requesting a physician to bedside for emergencies and it's being delayed. When it comes to physicians, there's a delayed receipt of urgent messages and difficulty prioritizing patient needs because everything comes in at once. And when it comes to the organizational impact, there are reduced communication efficiency and potential increase in near misses. Workarounds. Workarounds are where they bypass obstacles and substitute for unavailable resources. These include directly texting physicians, calling personal cell phones, repeating paging requests, contacting physicians through a coworker's phone, using informal communication channels such as text messaging or a social media site. The stakeholders when it comes to this application are nurses because they experience the delays firsthand, physicians because they're the ones that need the timely updates regarding the patient, the IT or informatics team just because they're the ones that are working with PBX and they're the ones that are going to have to develop alternative communication pathways. And in your hospital leadership, they're responsible for patient safety initiatives, and then patients and family are obviously very impacted by delays in their treatment and decision making. In conclusion, queue delays occur, especially during urgent calls. You feel like you're waiting on the operator for so long, and this can impede patient safety. Operator-mediated systems add extra communication steps. There is poor FITT alignment between users, task, and technology. Literature supports that there needs to be something better for timely communication, and then direct communication tools will improve responsiveness. Lastly, these are my references. Thank you so much for watching my presentation, and I hope you enjoyed it.